Hello students, I hope all of you are doing well. In previous videos we have discussed about the basics of critical reasoning, and in today's video we will discuss how we are supposed to approach CR questions. So let us get started. First thing is we are going to read the question. So let's read the question together. Alex, in 1800s it was discovered that 1 in 6 women who gave birth in hospitals died from a fever contracted after delivery. Okay, what this means, this premise basically is hinting that women who delivered in hospitals have died because of some or the other reason. Now reason, maybe we will get the reason in the next part of the question. While mortality rates were lower for those giving birth at home with a midwife. This was due to doctors' poor hygiene. So what was the reason? Doctors' poor hygiene practices, including unclean hands and instruments, which introduced pathogens into bloodstream. Fortunately, hygiene standards have greatly improved today, making childbirth safer for women. Jordan. However, doctors today are often so overwhelmed with their workloads that many, despite understanding the importance of good hygiene, do not have enough time to properly wash their hands. As a result, the risk of infections caused by doctors might still be a concern. So there are two things that we have to really consider here. First thing is, in earlier days, in the older days, during 1800s, it was observed that women who were going to the hospital were dying as compared to women who were delivering babies at home with the help of midwife. However, the reason given was, or the whatever the reason that is mentioned here is, there were compromising hygiene standards previously in hospitals, of course, as compared to home. But now the hygiene standards have improved. But there is another argument, additional argument, that says even if hygiene standards have improved, people have understood the importance of hygiene, still because of the time constraint, doctors and nurses, they are not actually able to maintain that. So that's the thing that we are talking about. Two things are there. Now let's read the question now. Which of the following could Jordan use to challenge Alex's reasoning further? Alex's reasoning was that this was due to doctors' poor hygiene practices, including unclean hands and instruments. So what kind of poor hygiene he is talking about? Unclean hands and instruments, because of which pathogens were introduced into bloodstreams and infections used to happen, right? So this is the specific argument that Alexis is giving us, and according to the question we have to weaken this argument, challenge Alexis' argument, right? So let us go through all the options that are given and finalize one of them. First is, a nationwide survey revealed that experienced doctors are more likely to believe they are not carrying pathogens. Okay. Second is, it is reported that approximately 50,000 people die each year in our country from hospital acquired infections. Okay. Compulsory hand washing is rigorously enforced for doctors and nurses before more major surgical procedures. Now when we are saying that compulsory hand washing is enforced these days, this is not certainly weakening that argument. We are strengthening Alexis' argument because we are agreeing that previously it was not there, but now they have this rigorous, practice. They rigorously practice washing hands and instruments before they use it for the patient. So this certainly can't be our answer because it is not challenging, it is strengthening Alexis' argument. Next is, in a study, doctors handling newborn babies self-reported a 90% hand washing rate. Again, it self-reported, right? So this is not a survey, it is not a research, it is a self-reported, survey, you can say, of course, but nobody is checking really whether it is happening or not, right? So again, even if we hold this true, this is again strengthening the argument. So 3, 4 is out of question. These options are not the correct ones. Nurses also struggle while maintaining strict hand hygiene, particularly during busy periods. Now we are only talking about a short span of time maybe. Now busy periods either may be entire year or it may just be a couple of months. We don't know. But are we talking about simply busy periods here? We are talking about overall, uh, understanding of hygiene and practices that they follow, right? So this again cannot be our answer. So 3, 4, 5 are out of question. Now we have to decide only from first and second. So second is, it is reported that approximately 50,000 people die each year in our country from hospital acquired infections. Now we don't know that from where they are getting these infections. Hospital acquired for sure, but are they getting these infections because of doctors and nurses, or is it because of the other people, compounders or other things that are there? So we don't know the exact reason, so it is little vague and overgeneralized. Again, this can't be our option. So the only option that remains here is option number 1. But before deciding whether option number 1 is final or not, let us give it a read and let us check if the reasoning is correct behind it. A nationwide survey revealed, now we are talking about nationwide survey revealed, that experienced doctors are more likely to believe that they are not carrying pathogens. If they are not carrying pathogens, automatically it is hinting towards they are not bothering enough to clean their hands, isn't it? If they are not bothering enough to clean their hands, of course there are higher chances of them operating patients or treating patients with unclean hands. Now this is very much in sync with Alex's previous argument. Not in sync does not mean that we are strengthening it with this, but of course Alex also said that they were not washing hands before, they were not very much concerned about the hygiene that they follow, right? So here also we are saying that the doctors, even now, most of the doctors feel that their hands are clean, right? Expert doctors feel that, and that's the reason they don't wash their hands. Automatically we are challenging Alex's argument here. So first one is the correct option. All right, so I hope you have understood how you are supposed to approach critical reasoning questions with the help of this example. If you have understood, liked, please make sure you subscribe our YouTube channel, because we are going to start with concept builder videos for reading comprehension. So please stay tuned and see you in the next video.